as you can guess, it wasn't a hard decision on what topic to have this year. And one of the things that we've been seeing here are questions about what is the impact of the COVID virus on diving, and can you use hyperbaric chambers to treat COVID-19? So the first thing you have to realize is the amount of damage this stuff can do to your lungs. If you have a serious case of it, it can do major devastation to your lungs. So a normal lung, you've got good, clear airways, you've got the ability to exchange gas between the lungs and the blood. And down in the alveolar sac area, you have a very, very thin wall that allows this transport of oxygen in and carbon dioxide out. If you have the virus attacking, it will start to replicate within the lung tissue. And when that starts to happen, then the body will start to respond by sending basically agents to come and attack the viruses. So a byproduct of that, with sending the white corpuscles and other items to this area, is that it can cause swelling. And it can get to the point in some of these areas down here where you actually will break down the lining of the lungs. And you will end up with fluid building up in the lungs. And you can get to something called acute respiratory distress syndrome. And that can then go to systemic inflammatory response syndrome, where you can then get the virus attacking other organs in the body. So these are the serious areas. These are the things that major issues occur. People have difficulty breathing. They may need to be hospitalized. They may need to go on ventilation in order to make it through. And in more serious cases, you can actually see where the damage in the lungs is. This is a 3D CAT scan image of somebody who has the COVID-19 pneumonia. And you can see that it affects large portions of the lungs. And these areas may be damaged. They may or may not recover, but it could take a while. If the person does recover, it could take a very long time for that person to recover. So if you do have COVID-19 and you have recovered from it, what are the risks involved? Well, most of the people have been talking about this limited case series from Austria, where it showed that 6 patients who were divers had severely damaged lungs even 5 to 6 weeks after they recovered, and even though they felt free of symptoms. 2 had deficits that were typical signs of pulmonary shunting, which means the blood going through the lungs without getting oxygenated. They had 2 that had irritable lungs during exercise, like asthmatic, and 4 of the 6 had significant lung changes. So this is what's being presented out there in terms of some of the groups saying you may not be able to go diving after recovering from COVID. So does that mean that people who do recover, will they be permanently unfit to dive? And the answer is maybe, maybe not. We don't know. We don't have enough data to make good conclusions. And so there is a response from the Undersea and Hyperbaric Medical Society that addresses this. And if you're interested, the full response is posted on our Facebook page. But basically they're saying at this time, we don't have enough data to support or refute the conclusions made by this case series. And anything that's out there that is looking at a case study with this few numbers should be looked at very skeptically, because you've got people who have symptoms that range from very mild to very severe. And damage that's done to the lungs may be temporary or it may be permanent. And so they concluded that the findings were very disquieting, but it's going to take a while to get more information in order to determine what the lasting impact of lung and health function and heart function are on these patients. And it's just like any other type of very serious pneumonia, you cannot expect to get over it and right away get back and do your normal activities. And then sometimes it'll take weeks or months, depending on severity and the damage that was done to the lungs. So the long-term recovery will vary. And until there's more data out there, there's no way to predict what the outcome is going to be if you do have the problem and you recover from it, what your ability, how your lungs will be able to recover, and what function you'll be able to have, and if that will be enough to allow you to safely go back to diving. So as they get more data, they will take that data and come up with recommendations to determine fitness to dive. And so just in conclusion, if you have recovered from COVID-19, you should talk to your physician and determine your personal fitness to dive and see what studies they recommend to make sure that your lungs are not compromised at all. Because your lungs play a major role in diving. And if they're damaged, it could lead to undeserved air embolisms or other problems. There's some concerns you may be more susceptible to oxygen toxicity. So there are things that we don't know that you should take into account, that we have a lot more knowledge that we need to get to make final conclusions on this. The other question is, should hyperbaric chambers be used to treat COVID-19? And this comes back to work that was done in the 1920s, well, actually the 1918-1919 flu pandemic that Orville Cunningham did in St. Louis. And basically what he did was take patients with the severe symptoms, put them in the chamber under pressure, and allowed more oxygen to get into the body than they would just at sea level. He didn't treat them with pure oxygen. He just treated them with air, but that increased the amount of oxygen partial pressure, allowing more oxygen to get into the tissues. So there have been people who've been promoting this based upon the work that Cunningham did, but it's not exactly the same as what we would see today, because the amount of oxygen Cunningham was able to deliver can easily be delivered by surface oxygen administration. But there is a case series, once again, a very, very small case series, so you should look at it very skeptically and in terms of just critically analyzing whether it is showing what's a trend or whether it's just the results of these 5 patients. But it showed that the possible use of hyperbaric oxygen, the use of hyperbaric oxygen was beneficial for these patients. And the benefits that are being looked at is you can increase the amount of oxygen getting into the arterial system where you've got a very hypoxic environment in those lungs that are very wet. You might be able to diffuse enough oxygen through to keep the body going. Now, once you take that oxygen away, your oxygen levels are going to drop. But that's one of the things they're looking at. The other thing that they're looking at is that hyperbaric oxygen can reduce inflammation in other organs, and it may be that you could do the same for the lungs and actually reduce the amount of swelling, reduce the amount of inflammation, and therefore mitigate the damage that's being done by the body's own response to the virus. And in fact, this is a study that's being looked at at UCSD at their chamber. They're starting up a clinical trial looking at that. The potential risks in the chamber, you've got barotrauma, and it should be barotrauma, not barotraumas, because of the damage to the lung and because the amount of oxygen people are getting being treated for COVID-19. There is the potential risk of increased pulmonary oxygen toxicity due to the irritability of the lung tissues and the amount of oxygen they've got. So the big thing is that clinical studies are needed. And at this time, there are 5 out there, and there's a paper and resources also at the UHMS website that will go into the clinical trials that are being set up to test the efficiency of hyperbaric chamber treatment on COVID-19. So what should you do? Stay healthy. You know, to follow the public safety guidelines. This is a great time to sit down and take advantage of some of the online programs and training that are being offered for free in a lot of cases. There's some that will give you exercise programs in your home. One of the big things for diving is breath control and mental, because this is one of the benefits that you can get in diving by being able to calm yourself and put yourself in a situation where you are at less risk of panicking. There's various diving webinars that can increase your general diving knowledge that you might be able to find. And just when things start being eased up, ease yourself back into things. Don't think you can just go straight out and do everything at the same level of activity you were doing before the lockdown started. So hopefully, if you take it easy and take care of yourself, and if you've had the problem and you've had COVID-19 and recovered, make sure you check with your physician. But hopefully we'll be seeing people getting back in the water, and maybe next year we'll see you out here for Chamber Day instead of over this video link, and hopefully not before. So thank you.